Welcome all of you who are joining us. I'm going to wait another minute to get a few more folks connected. Appreciate you being here and spending your time with us today. All right, I have straight up 1 o'clock, so I'm going to go ahead and get us started. Welcome again, and thank you for attending today. We value your time and invite your input throughout our session today. This is a Zoom meeting format, so you will be able to mute and unmute yourselves to ask questions or share your insights. But in order to avoid distractions, as we hear from our presenters today, we ask that you be on mute unless you are speaking. You are also welcome to enter questions in our chat if you prefer. So here's our agenda for today. I am incredibly excited and happy to have One Health community health centers doing a practice presentation for us today on their implementation and use of the Prepare tool to assess and address social determinants of health. We're also going to talk a little bit about the county health rankings data and some additional resources that I found online and then continue to research myself. Just at the end, a little overview again of health equity and social determinants of health. And then basically wrapping up saying one small step for humankind is just taking a small action step forward. So hopefully you'll have enough information and energy and enthusiasm and inspiration from this presentation in order to take steps forward. So please help me welcome today's presenters. Jessica is the Optimal Performance Manager at One Health Bighorn. I believe that's Hardin, Montana. You can correct me later if I'm wrong, Jessica. She received her bachelor's degree in healthcare administration from Montana State University Billings in 2019. Jessica has personal experience with cancer. She was diagnosed with leukemia at age 11 and luckily has been in remission for 13 years. Because of this life experience, she is passionate about patient advocacy and improving health outcomes for underserved patients. Next, we have Lori. She is the Health Advocacy Manager at One Health and offers her perspective of raising a large family while living in poverty. She has learned the art of making meals stretch, as well as how to manage type 1 diabetes, celiac disease, and learning challenges in 5 of her 8 children. To counter the cycle of poverty, Lori enrolled at Montana State University to pursue an education in community health. Lori successfully graduated with her bachelor's degree while going through a divorce and adjusting to the rigors of single motherhood. Lori's passion to be an advocate for low-income families, families with diabetic children, and children with learning challenges continues to be her drive in her future pursuits in her master's program and goal to be an educator mentor for others. I am truly inspired to be presenting with both of you today. And I'm Deb Anderson, a certified professional in health information management systems and a consultant for Mountain Pacific Quality Health. Most of you are probably familiar with my face now, but you may not know that I grew up on a farm in rural Nebraska with 5 very ornery brothers. My mom was a nurse in the Army in the late 1950s, and she now resides near me in Sheridan, Wyoming. We've had quite a journey over the last 2 years, and I hope that my experience can be helpful to others who are faced with the challenge of aging parents and their desire to be home, even past the point of being safe or well cared for. Thank you again to our presenters and all of you who have joined us today to discuss assessing and addressing social determinants of health. I am very honored to turn this over to Jessica and Lori to share their presentation. Take it away.
Thanks, Deb. It's good to meet everyone, and we're excited to be presenting on this topic that we're very passionate about and put a lot of effort into. So first off, we will introduce you to kind of One Health. So if we can go to the next slide. One Health was established October of 2012. So we were originally called Bighorn Valley Health Center. And that was at our Hardin location. We have merged with 6+ additional sites, and we continue to grow across the state. And so I just kind of listed some of the names of the health centers. So that was One Health in Miles City, Central Montana Community Health Center in Lewistown, and Sweet Medical Center in Chinook and Harlem area. We serve roughly 10,000 Montanans. Our mission is to improve the well-being of everyone by providing accessible quality healthcare to all of the communities that we serve. I put that on here because I think that really shows, that we hold that in high regard, and that is why we really wanted to pursue a social determinants of health screening like Prepare. It's literally baked into our mission. We really want to provide quality healthcare, and we think that the Prepare screening is a great way to do that. I've also listed some of our service areas. So our big ones are behavioral health, integrated primary care. And so we integrate behavioral health, dental, pharmacy, other preventative health services. In a couple of our communities, we are also public health. So, we kind of have a dynamic group, and we're constantly, seems like we're constantly growing and doing innovative things throughout Montana, which is really exciting. We'll go to the next slide. So this is just kind of a geographic map of where our sites are physically located. Of course, now with telehealth, we can essentially see patients anywhere throughout the state of Montana, which is pretty exciting. We've also started a school-based telehealth program in a couple of our communities, and working on other communities so we can offer primarily behavioral health services to school-age children and staff. Go to the next slide. Awesome. So this is just a little snapshot of kind of what our patient demographic looks like. Obviously, we have way more in-depth information here, but I wanted to just kind of pull out the snapshots that I thought, kind of made our communities more diverse and really just a good fit for a tool like Prepare. Arguably, anybody that is receiving healthcare could and has experienced social determinants of health, but I really think that when you're looking at specifically like the insurance, so we see that 12% of our patients are uninsured, 17% of those are of our patients receive Medicare services. So in my mind, those are kind of like, I don't want to say like a flag, but kind of like, a trigger of, okay, these patients are at risk. Those are patients that we definitely want to check in with and make sure that they are receiving the highest care available to them. So so that's just like kind of a high level screenshot of the patients that we serve currently. Go to the next slide. So let's jump into what Prepare is. And I'm not going to read all of this. Deb said that the slides will be available within a week. But I just wanted to point out that Prepare is an acronym for protocol for responding to and assessing patients' assets, risks, and experiences. So for the longest time, I spelled it Prepare because I think, oh, we need to be prepared, but it's actually Prepare, and it is an acronym meaning that. So we can go to the next slide. Awesome. So this slide is one of my favorite slides, and this really shows why we decided to implement Prepare at One Health. So really, why is it important? Lori and I, not only do we take responsibility for training the community health worker staff, Lori is the supervisor for our community health workers across the organization, but we also take responsibility for training all other staff, so clinical staff, and really telling everybody, what the importance of Prepare is. And so this is a slide that we feel is really powerful that we like to show everyone. So Prepare is important because we're simply addressing social determinants of health needs, simply, right? It's a big job. We want to improve patient health outcomes, meaning, simple things. If patients, like let's say with diabetes, Lori's expertise, if we have a patient that needs diabetic medication, but they don't have a safe place to sleep, or maybe they don't have a place to keep their medications, like a refrigerator or things like that, then their health outcomes are likely not going to be as quality as those patients that do. So it's our job to kind of identify what are those needs that those patients need met in order to be their healthiest selves. And so we really feel like Prepare is a way that we've been able to impact those patients. I also want to point out the Montana Food Bank Network slides or photos on this slide. We were able to take the prepared data collected over, I believe it was a 1.5 or 2 year span of using the screener to apply for a $5,000 grant through the Montana Food Bank to actually receive food. I think 250 food bags, and we've almost distributed all of them at this point. So we were able to go. I actually physically went to Albertson, and it was during the beginning of COVID. So I think people thought that I was like hoarding food in my basement or something. But we went and bought all of this food, brought it back to Hardin, and we have it located in a pantry here. And we've been able to distribute this across all of our sites. So it's like a tangible object that I think everybody can get behind and really understands that food is something that everybody needs. And if we weren't able to collect this data over that 1.5 years, we wouldn't be able to, have told the story to funders to be able to receive this type of resource. Another resource that we received was a grant through Montana No Kid Hungry. We quickly realized that being able to store the food in our clinics was a challenge. There isn't a lot of our clinics are functioning, in very small areas already. So there wasn't a lot of room. We also found that our patients, if they had specific dietary needs, that this was kind of a nice gesture, but it wasn't really like meeting the need all of the time. So Lori had a really great idea along with the community health worker team that we offer a food voucher rather than actual food. So now what they do is they give $25 gift cards to local grocery stores so they can shop for their own food and meeting the needs of their own family. So that's been a really great experience as well. And then the bottom right corner, these are other common resources that we and our community health worker team refers our patients out to. So Prepare is like a catalyst for that. So a lot of these were already established partnerships, but after we started utilizing Prepare and really seeing the needs of our patients and capturing that data, we were able to build even more robust relationships with these community resources. So I think that's all I have to add on this side. Lori, do you have anything to add here? Did I cover it?
The only thing I think I might add for the No Kid Hungry food voucher program is that initially we started out not having an income eligibility requirement, but the need, especially in Hardin, has been extremely high to where we are giving out 100 vouchers a month to families, and the majority of the families isn't just one family getting one $25 voucher. It's a family of say 5 or more with 5 or more children. And so they're getting 2 to 3 vouchers per family. So we had to change that. And now we have income eligibility. We are requiring our patients to be on our HSP program so that we can limit the amount of patients that are getting the vouchers.
So that's a good point. And so just to piggyback off of that too, and then, if anybody has questions after this, Lori and I are more than happy to troubleshoot or answer questions about how we received some of this funding or how we went about applying. But with both of these grants that we applied for, a huge part of our mission was really to empower patients, but not, create a situation where they're reliant on these programs either. So what we do with every voucher that we give out or every food bag that we give out, we also talk to our patients in depth about other resources in the community for food access. And then we also get a clear picture of where they're at. is the reason that, they need food is maybe that somebody got laid off during COVID, or, they're in transition in some way, or something else is going on. And so we don't just, give somebody a food bag and send them out the door. We're really getting a picture of where they're at in their life and trying to see how we can address that. The food in clinic is kind of something to get them from A to B. If a patient comes in at 5 o'clock at night, it's really just a way for us to help bridge that gap to bigger, more sustainable resources. So I just like to add that on there. Awesome.
And using the prepare screening is a way to be able to assess more fully what all of the needs are that a patient has. They might come in for, like Jess said, they might mention that they have food insecurity, but through having an interview, the community health worker having an interview with the patient, they might find out that they're living in their car, or that they don't have running water, or whatever the need might be. And so we can give them resources to meet all of those needs.
Exactly. Whereas otherwise we wouldn't really know. And so onto this slide, that's a great way. I would like to share with you guys, a big success that I found when we first started utilizing Prepare. And this was when it really clicked for me that Prepare was so powerful. We had a patient, so I used to be a community health worker, and I would go into the patient's room and just touch base with them. And I had a patient that their Medicaid had lapsed. And so I just went in and checked in with them and talked to them about their Medicaid. So the way that we do Prepare our site is the nurse or the MA typically does the Prepare interview, because there's only one community health worker at each site, but every patient is going to come in contact with a nurse or an MA. So as far as bandwidth, we felt that made the most sense. So we had a patient come in, their Medicaid had lapsed. I went in to address their Medicaid need and just let them know, I'm a community health worker. If you have any additional questions or needs, I'm available to you. Very pleasant interaction with this patient, and I left the room. Minutes later, the nurse came in and did a Prepare screening, finding out by asking those specific questions that the Prepare offers that this man was in a situation where his landlord was not taking care of his housing needs. So this was winter time. He did not have running water. This, as Lori said, did not have running water, and his heater his heat source did not work. So he was actually using a milk house heater to heat his apartment, making his electricity bill $700+ for the previous month. And so what we were able to do is identify that and let that patient know, hey, we really care about these social determinants of health needs, because I think a lot of the times, patients or community members, they don't realize that healthcare cares about those things, for one. So it's almost like an education piece of like, hey, we do care and we want to help you and support you through this. The other piece of it is we were actually able to do a referral to Montana Legal Services and hold that landlord accountable to the point where the landlord not only fixed all of the needs in the home, but also had to pay for the electric bill for that patient. And so to me, that's a huge win. Originally, I first, after the nurse came back to my desk and said, hey, this patient has all of these needs, I felt guilty. I was like, oh my goodness, I was in the room with this man for 10 minutes and I didn't know any of this stuff was going on. But if you just say to people, oh, let me know if I can help, it's not, I don't think it's as helpful as if you ask the specific questions that Prepare has been designed to answer, if that makes sense. Lori, do you have anything to add to that?
Two things. I think sitting down and doing a Prepare with a patient, yes, you're asking specific questions, but those questions give you the open door to have a conversation with the patient. And once they're comfortable, after they start answering 2 or 3 of the questions, it gives them the opportunity to feel more comfortable. And they most oftentimes will open up and start talking to you about other things that are going on in their life. Many times we've been able to refer patients for behavioral health services. one success story that I would like to point out is I had a mom and her daughter who both needed specialty care appointments. The mom needed to go to Billings for her appointments, and her daughter needed to go to Colorado Children's Hospital for her appointments. And the mom was really stressed out about the finances she would need to get to these appointments, especially the appointment in Colorado for her daughter. That appointment would require her to stay for 2 days in Colorado, and she just did not have the funding. We were able to not only give her some of the No Kid Hungry food vouchers, which helped her to have food for the hotel, but through connecting with the social worker at the Children's Hospital in Colorado, we were able to get her coordinated care for 2 days in a hotel covered by Colorado Children's Hospital. So that mom had that peace of mind that not only were her food needs met, but she also was able to have the care for her daughter without worrying about how she was going to stay while she was there. And so those are just those victories, those success stories that we get to partake of and celebrate with the patient.
Exactly. Yeah, and we have many more, but those are two that really stuck out to Lori and I that we wanted to share with this group. So awesome. So this slide is how we screen and the frequency of screening. And so this has all been kind of developed through trial and error, doing, kind of research, talking with other health centers. And so when we first started Prepare, we felt like we were in kind of a position where not a lot of people were utilizing this tool yet. And so we had to figure out, how does it work for us? How does this work in community health? And how does this work with our EMR? So we had just changed EMRs. We used to use ECW and we switched over to Athena. I was kind of bummed out because ECW at the time had a prepared template and Athena did not. So we had to kind of create a little bit of a wraparound on how we screened our patients. Additionally, I had mentioned during my success story that we did a referral to Montana Legal Services. One Health actually pays for a partnership with Montana Legal Services so we can offer free civil legal aid to all of our patients. So with that, the Montana Legal Services referral or screening form, I guess is a better way to say this, was actually developed off of Prepare as well. And so we started looking at this and, you hear patients constantly, they say, oh, we're given too much paperwork, or we really want to limit, the amount of questions that are being asked, especially if they're the same question. If a nurse comes in and asks you a question and the doctor comes in 5 minutes later and asks the same question, it can cause irritation and all of that. So we really wanted to make sure that we were providing our staff a tool that was useful to patients and not creating issues, right? So we recognized that Montana Legal Services was based off of the same Prepare screening. So the questions were almost identical, if not identical in some fashion. So what we did is we combined Prepare and Montana Legal Services. So when One Health refers to the Prepare screening, we're screening for both of those. So we're screening for Prepare and Montana Legal Services. We also decided as an organization that we were going to utilize empathic inquiry and motivational interviewing. That's something that our community health workers are very good at. They're all trained on. And so what we're doing right now as a work group is we're really trying to get everybody in the organization exposed to that in some way. So empathic inquiry, is basically coming from that empathic point of view. One example that I can give, and I don't think that people are ever coming from a place of, they're not trying to be harmful, but depending on how you ask some of these questions, it can be. So I shadowed a nurse during the very beginning of Prepare implementation. And I think that it wasn't clear, in training, that's partly my job, of how we wanted to interview these patients and how we wanted to ask these types of questions. And so the nurse, said to the patient, well, we're required to ask these questions. Are you homeless? And that patient, felt, I think, like caught off guard and didn't really answer and declined the whole screener. And so for me, that was a really great example of, if we don't ask these questions in a really kind and empathetic manner, we can miss an opportunity to really help our patients. And so thinking about, how you would feel if you were the patient, putting yourself in those shoes when you're giving the interview. So motivational interviewing is another really great tool, and many of you probably already know about it, but it's just a way of kind of using, their skills and what they have available to them to help them brainstorm and come up with solutions for their situations. So we're not, telling people what we think they should do. We're giving them an opportunity to really collaborate and come up with great solutions for themselves. So for screening frequency, we originally decided as an organization that we would screen every adult patient every time. So then after we did this for a couple of weeks, we realized that we needed to kind of exclude minors, DOT physicals, disability exams, and incarcerated patients at this time. So those are things that we may look at addressing in the future, and Lori will get into some of that. But as far as like fundamentals for doing the screenings, we found for our practice, we needed to exclude those patients. So let's see, where am I at here? So we had an original goal of doing every patient every time. That's kind of a big ask. So then, as an organization, we kind of realized, okay, that might have been a little much. How can we bring this down? Because like Lori said, when we give a patient a Prepare interview, or, we're conducting a Prepare interview, if you touch on a subject that a patient has a need, those interviews can go, anywhere from 10 minutes to an hour, depending on what's going on and the severity of the need. So we had to figure out, how can we pre-screen these patients? Because we might have some patients that don't have any needs today, but we still want them to know that we care. And if they do have needs in the future, that they can come in and talk to us about those. And then we also wanted to create, a situation where, or a pre-screener is what I'm trying to say, create a pre-screener so that way, it's just alleviating time for staff as well. So, and we'll get into that on another slide as well. So what we do right now at our Chinook site, we're piloting this idea. And I think we are in a position where we're going to be able to move forward at other sites, but this is the Chinook pilot. So this team has implemented a paper screener. So that's this screenshot on the right. So patients can fill this out. At the bottom, they have the option to decline if they have no needs that day, but it's really just a quick visual where patients can say, okay, I'm having issues with water, or I need childcare resources, and they can just circle that. And then that is given back to the community health worker at that site. And then they can go into the room with the patient or contact them after the visit, but we have screened for that, initially. Typically, what we like to do is, if one of those boxes has been circled, we really want the MA nurse or community health worker, whoever is available, to do that full Prepare screener. But this is just a way, like I said, to kind of alleviate some of that staff time. And if patients feel, if a patient had come in on a Monday, they were given the full Prepare, they come back on a Wednesday, they don't necessarily need the full Prepare, but this just gives them, time to update if something has changed between, visits. Do you have anything to add on this, Lori?
I just think that some of the feedback that we've gotten from the pilot in Chinook with this pre-screener it has been positive, in that this is given to patients as part of their intake paperwork. And obviously then a patient is doing this on their own. So it does decrease some of the time, like was mentioned there on the slide, of the triage time. And it has opened up conversation. So some patients have brought up the pre-screener when they're being roomed by the MA, that they had circled one or two of the needs on the pre-screener. And so then that gives the opportunity for the community health worker to go into the room and do a warm handoff and meet with the patient.
That's a really good point. I also want to point out that I think it was the Oregon PCA that started this pre-screener, and I just kind of took that and modified it. So we can't take credit for this. That was the Oregon PCA, but you know, feel free to take any of these ideas if they're helpful, but it's just really nice to know that there are other options and it doesn't have to be extremely rigid. Another thing that I was reminded of when Lori was talking is our Chinook site, because the full screener felt like such a heavy ask, they actually weren't doing many prepare screenings. So that's another thing that we were able to do is we went from not many, you know, prepare screenings to every patient receiving this pre-screener. And so now we know that every patient is getting some sort of a prepare, and then the full screener can be done PRN is what we say.
Also, Jess, as a reminder, as we took the actual pictures of the pre-screener and made it kind of into a small poster with community health advocates, is what we call our community health workers in the organization, with our central phone line, so that a patient would see this when they're sitting in the exam room waiting for the physician to come in. So it gives two opportunities. Mm-hmm.
Yeah, awesome. Thanks for sharing that, Lori. I forgot about that piece. So yeah, we've been getting some really good feedback on this, and what we're hoping to do is implement this across the organization. We really just wanted to check it out at one site and see how everybody felt about it there before we move forward. So that's where we're at currently with this pre-screener. Move on to the next slide. Awesome. So I touched on this a little bit. And each site, you know, tends to have a little bit of a different workflow. That's just kind of how it is. But this is the workflow that we train staff on. So like I said, at our site, we have the nursing and MA staff really team up with the community health workers to conduct the prepare interviews. And now the pilot intake staff as well, because they're the ones handing out the pre-screener. So nursing staff would room the patient consents to prepare. So we always give them the option to decline. What I've found is it really depends on how the prepare is presented. So if a staff member comes in and says, hey, I have to do this screener, do you want to do it? Most patients are going to say, no, I'm good, thanks, right? But if a staff member that is, you know, informed with empathic inquiry training and motivational interviewing, all those good things. I got a message, sorry. Then it depends on how they ask, right? So if you come in and you say, hey, I really care about your social determinants of health needs. You know, patients aren't going to know what that is, but the verbiage is different for everybody. But what I'm really trying to emphasize is the training and the way that staff present themselves when they are asking about this really sensitive and important information is huge. Like that's really going to make or break the success of the data that you're collecting and the opportunity that is presented to help a patient. So I really just like to emphasize on that. So if the patient says yes, and so I'll also say I've only had one patient ever decline prepare, and that was because they had already been in the clinic for an hour and a half and they needed to get back to work. So I've never had a patient decline just for the sake of declining, and most patients really appreciate that we ask these questions. It has been my experience. So if patient says yes, Then what we would normally do is check and see if the resource person is available. So is the community health worker available? If the answer is no, then the nursing staff would do this. So this has changed a little bit, like I said, with that pre-screener. But it's kind of like, I don't know, there's multiple ways to, do things on a computer. We're all getting to the end, right? So and that's how we like to train people. We're like, really, it doesn't really matter the exact steps that you go through to get there. We really just want to make sure that patients are getting connected. So whether it be the pre-screener, in person with the nursing staff, in person with resource, after the fact on the phone, not ideal, but we have done it, right? Especially with COVID. We really give our staff permission to be creative on how they conduct these screenings so we can get the information and meet the patients where they are. Did I miss anything there, Lori?
Is what you were saying about not having someone decline and how it's presented to a patient is that's important. And then also I always let a patient know that they can stop answering the questions at any time. They don't have to finish once they start. If they decide I don't want to answer anymore, then they don't have to. But many times, even when a patient is answering the questions, if they hesitate when they're answering, like, do you feel safe in your home, as an example? If they hesitate before they answer, you can, someone who is well trained can go back and say, you kind of hesitated on that. Are you sure there isn't something that you want to add, regarding that question? And many times I've had a patient say, oh, well, actually, and then they tell you what's really going on.
Yeah, that's a good point. And on that too, we've also have kind of not a rule, but the way that we train is like, if we get to question 3 and a patient has a really serious need, like they've just been kicked out of home or something is happening, we stop and we say, okay, let's address that. What does that look like? We don't necessarily make a patient sit there and, go through the whole thing. We try to really make it be a conversation and make sure that we're addressing the needs that are brought up in a timely and respectful manner. So that is a really good point.
Yeah.
Yes, we'll go to the next slide. And I'm just realizing time check. And I told Deb, I'm like, I can talk about prepare for hours. So I'll try to get through some of these next slides a little bit quicker. And if you guys have questions, like for example, if you're using Athena and prepare is something that you're looking at implementing, feel free to reach out and we can talk about the logistics offline as well. So Athena has just updated their social history tab. So we can really identify like which parts of the social history tab we want to access. So we now have a button for the prepare questionnaire, which we did not have before, and it made it extremely cumbersome. Before, we had all of these questionnaires that you see on the right were listed just as a list in social history. And so staff would get confused. They would go in, they weren't sure where prepare started and stopped, and that seemed to be a huge issue. So now that we have the ability to configure that tab, it has helped a ton, I think, with staff training and utilization of the screener. So patients would go into the social history tab, they would click the prepare questionnaire. You can, before you change slides really quickly, if you guys can see prepare screening date. This field has been very important for tracking. And like I said, I won't get too into depth, with all of the logistics of it, but this was how we could figure out how to track. And I will show you how we use Power BI to pull all this information into a dashboard so our community health workers can actually do something with this information. So just note that has been a really a wraparound way that we've been able to really track each prepare screening. We can go to the next slide. And so then I also wanted to show whatever was on that pre-screener form, we have listed out here just more in depth. And so we also give them the option to not answer the question. So if we have a patient that comes in, COVID's a really great example, right? If we have a patient that comes in and they're in a lot of pain or maybe not able to talk to us that day, then we would just hit, patient decline. And then in the screening notes, we make sure that we try to kind of paint a picture. Patient decline, patient seen for XYZ, unable to complete the screener today. But what we like to do is kind of keep that in the back of our minds of, okay, the patient wasn't able to complete the screening today because XYZ was happening, but maybe in 2 days or the next day, we would want to call that patient and say, hey, you were seen yesterday for whatever. We weren't able to finish this screening. We just want to check in with you and make sure that we didn't miss an opportunity to, to treat your whole person basically and address social determinant needs. We'll go to the next slide. So after the screening is done, there's a couple of ways that a staff can refer a patient to the community health advocate, which, like Lori said, is what we call our community health workers. We can send a referral. So in Athena, they're called buckets, and it's basically an inbox message system, like a phone system. And so you go in, you type, patient seen today, XYZ, needs Medicaid support. So then they would send that to the resource support bucket, and all the community health advocates would receive a notification that they have a patient need. The really awesome thing with our telehealth program is now our community health advocates can really support each other across the state. So for example, we didn't have a community health worker in a couple of our sites. I think Miles City, we didn't have a community health advocate for some time. And Lewistown, we didn't have a community health advocate for some time. And so what we were able to do is if patients came into that site, they could connect with a community health advocate at another site via telehealth or over the phone. So it was really nice to still have that support and be able to connect with our patients that way. So for example, I did a disability over Tidal Care. And I think, Lori, you probably have a list of times when you guys have been able to connect with patients through telehealth. So we use Teams or Skype is another, common used one. And we just created kind of a group. These are just ideas where maybe you guys could implement at your sites, but we just wanted to create multiple channels that staff could communicate back to our community health advocates. We didn't want to make it a siloed system. We really wanted to make it easy for people to use. We have some staff members that prefer to use Skype versus telehealth versus, right? So the staff members, the providers kind of get their niche and we just kind of run with it. We'll go to the next slide. So Deb really wanted us to go over how COVID-19 impacted Prepare. And Lori and I, we talked about this a lot, and what we really came back to is we think that the pandemic allowed staff to have a better understanding of why Prepare was important. So before, I think whenever you're implementing a new Prepare, a new screening, and Prepare is a big one, but anytime you're implementing a new screening, providers and staff might be a little bit reluctant because it is a lot that you're putting on their plate, but social determinants of health are so important that we really want to make sure that it's addressed, right? And I think the pandemic was not an opportunity, but really just showed our staff like, okay, social determinants of health are very important, right? Because so many people were laid off or things happened last year that no one had control over. But what we were able to do is connect our patients pretty rapidly with community resources because we were doing a Prepare screening. Same with patients. Patients were more willing to answer the questions in depth and have the conversations with us and actually utilize our resources more. For example, the food vouchers and the food bags that Lori's team gives out. Did I miss anything here, Lori?
No.
Okay.
You touched on all of it.
Awesome. Okay, next slide. Try to get through these. Yeah, so I just wanted to point out kind of the history of it, and then I'll pass it over to Lori. I know I've been talking a lot, and I'll let Lori kind of take the current state because it really is her team that is doing it at this point. So in September of 2018, only 18 patients had documented social determinants of health data in our EMR. So there was no streamlined process in place for collecting that data. And so we recognized as an organization that that was really important, and Prepare was a great way for us to address that. So anyways, I just wanted to point that out, like 18 patients, and then I'll go to another slide and I'll show you how many we've done at this point. Laura, do you want to talk about the current state of our Prepare program?
Well, we already discussed the Chinook pre-screener pilot project, which seems at this point that it's going very well. And like Jess mentioned, it looks like we're going to roll that out to some other sites as well. Our Prepare work group meets regularly, as Jess already mentioned. And again, Jess mentioned, we are expanding into school-based telehealth and school-based care. And with that, we are looking at rolling out an adolescent screener for Prepare. So I don't have the exact details on that, the adolescent screener. Do you know the dates on that?
We don't have dates on it. What we're doing right now is just kind of researching what makes sense. And this is kind of like the next step for us for Prepare. We feel like the current system that we're using is really working well, but we don't have a good way to screen adolescent patients yet. So it was kind of comical. We did a Prepare screening on like an 8-year-old, and we asked them how they were paying for their utilities, and they looked at us like we were crazy. And so it became clear very quickly, like, okay, we need to ask these questions in a way that makes sense to somebody that maybe isn't accompanied by a parent. And so with our school-based telehealth program, there will be times that patients will, it'll be consent of the parent set up before the visit happens, but the parent isn't physically available when those telehealth visits happen. So we're working on that still. We can move on to the next slide. And I think this is, so we're going to be getting into the data piece, and I'll kind of just run through this quickly because I know we don't have a ton of time. But so what we do is we pull all of the Prepare screening information into a dashboard daily. Just going to get through these and then we'll answer questions. So all the information is pulled at night and compiled into a dashboard, and then Power BI kind of configures that. And we have a whole data analytics team. So I'm sure I'm butchering the explanation of this, but what I know is that it gets pulled daily, and then it gets pulled and put into this awesome dashboard where our team can see the information and we can use it. So also with this was a catalyst for the Community Health Advocate Charting Project. So not only do the community health advocates, conduct the Prepare screening and connect with the patients, but now they're also going to be charting in our EMR alongside providers, behavioral health providers, medical providers. So it really is an integrated piece of that care plan. So providers at any time can look and see, okay, our community health advocate is helping this patient get Medicaid. And maybe that would be a catalyst for how they would move forward with surgeries or medications, things like that, if they're waiting, for approval for Medicaid. That's just one example. So we had an option to use a Prepare template. I told you guys at the beginning, we had ECW, and I was a little bit bummed out because Athena didn't have a template. Well, last year, or I guess it was the beginning of this year, they released a Prepare template, and this was actually in a beta form at that time. I'm not sure exactly where it is now, but we opted out of using that. And the reason that we decided to not use the Prepare template that Athena offered is because, like I said, the Montana Legal Services and Prepare we have combined that. If you use the template, you cannot configure the questions at this time. You can't edit the questions or rearrange them how you think makes sense for your practice. And we would have to had separated Montana Legal Services from that, which would have, put an additional step or steps into that workflow. And our staff, didn't think that that was the way that we wanted to go at this time. However, if you were just starting with Prepare, I think that this template would be a really great option to look into. And so Athena has so many great resources and videos on that. If you are an Athena user, I would definitely look into that. This is going to be continuous. We are still refining how we track patient outcomes. We will probably always be refining that and finding new ways to be better about that. And then I also included a little quote, which this is one of my favorites. Without data, you're just another person with an opinion. And I think that is really powerful, especially when you're talking about social determinants of health, because I think we all know that this is important, but if we don't have data to prove or to show, we aren't able to apply for grant funding. We're not able to really meet those needs on a bigger scale, I guess. So that's why I would really say that collecting the data is very important. We can move on to the next slide. So this shows you the historic trends. So a few slides ago, I told you in 2019, we had only done 18 screeners. Now you can see in this year alone, we've done 8,860 prepares. So but by implementing a streamlined process, we were able to go from 18 patients to almost all of our patients having social determinants of health screenings or data in their chart, which is huge because that was a piece that we were missing before, but it is so important. We'll move on to the next slide. And so again, this is Power BI that our organization uses. So this is a previous week's screenshot. So this is a space where our community health advocates can go in and look at what their site is up to, how their screening numbers are. We've even joked and talked about trying to do competitions across sites. We haven't really gotten there yet, but you can really see, Hardin right now is leading Prepared. This isn't always the case, and COVID definitely has changed this, but it's really just a way to tell a story. We can see how staff doing at this site, like, for example, Ashland, they've had a lot going on there. So we see that they're currently doing no screenings, and that's not, a bad thing. It's just for us to know as the work group, okay, maybe that's an area that we need to work on. And then we can also see that there was 178 screenings completed, but that's less than half of the opportunities available. So maybe that's something we would want to focus on for continuous improvement. We can move on to the next slide. Yeah, so then we just wanted to move on to lessons learned. And Lori and I talked about this for like 10 minutes, and there were so many things that we learned from this process and so many things that we continue to learn as we're going. But the two big ones is, that we really think that we would really want to share with you guys is clear communication and support from top leadership all the way down is really important, right? We want everybody to know why, as an organization, have we decided to move forward with this initiative? And I don't think that was always clear, in the beginning. So then Lori and I come in and we go, okay, we're going to talk about Prepare, and people think, okay, why do we care? How does this align with the strategic plan? What does this mean? And so I think it's really important to convey that right out of the gate. And that also creates the staff ownership and buy-in, right? We want people to understand why we think this is important and how it works all the way through from start to finish, so they really know what their part is and what their piece is in that. So those would be our two kind of lessons learned to share. And like I said, we have a million more. And then I think the next slide is questions, right? Yeah, so, and it looks like we have one in the chat.
I see what I put in. I haven't seen any questions come through to everyone. Is there one maybe directed to you privately?
It must have been, yeah, direct. So it says, sorry, I may have missed this information earlier, but how big is your organization and how many patients in your panel? So our organization is 6+ sites. We're constantly expanding. It seems like we're always opening up a school-based or a little clinic somewhere. But we're kind of across Eastern Montana right now. and we service about 10,000 patients at this time. I think as far as staff, we're at like 197 or something like that.
So we're happy to address questions in chat, or if you would like, you're able to take yourself off mute and ask a question directly. So I think what I'm going to do is I'm going to go ahead and hit a couple more of the slides that I have, but we'll continue to watch for questions for Lori and Jessica. But thank you guys. You did an amazing job, and your passion and your work is really, truly inspiring, especially for me. So now it's time for my IT talk about the foundational pieces to social determinants of health in my world. Although, Jessica, it's your world too, because you talked a lot about the data. But it's not just any data, it's what we like to call healthy data, because it's collected, validated, and shared as appropriate. As we work toward our lofty goals of data interoperability across the nation, it's important to remember it all starts with our local data. How do we collect and share the trusted data? I know it sounds like a silly answer, but I would say very carefully. And quite honestly, Jessica and Lori, you guys talked about very carefully having this information collected by trusted people, carefully recorded in your source systems like your electronic health records, and carefully shared with the appropriate patient consents. So again, you guys did a great job with your presentation, and I really, really appreciate all the time and effort you've put into preparing that for us and sharing it with us today. So I have to be really honest and tell you, I didn't understand the significance of the collection of real data or the SOGI data until I began learning about the health disparities and the impact they can have on the outcomes. There are many staggering statistics available, especially during COVID, but it didn't just start being an issue. It's been going on for quite some time. So healthy data and good patient matching data will be the bedrock for analyzing the improvements that together we can make in our communities. I found some additional resources that I'm sharing here, not just on the resource slide, but if you haven't seen the county health rankings, I think it's a great site to take a look at. They work to improve health outcomes for all and to close the health disparities between those with the most and least opportunities for good health. This work is rooted in a deep belief in health equity, the idea that everyone has a fair and just opportunity to be as healthy as possible, regardless of race, ethnicity, gender, income, location, or any other factor. The program provides data, evidence, guidance, and examples to build awareness of the multiple factors that influence health and support community leaders working to improve health and increase health equity. The rankings are unique in their ability to measure the health of nearly every county in all 50 states and are complemented by guidance, tools, resources designed to accelerate community learning and action. So again, if you get a chance, go out and find the site, or it will be included as a link here in the slides as we share those. Here's my favorite little picture that helped bring it all together for me a few years ago. You know, we talk about equality, and equality is great, except none of our needs are the same. So what we're really truly trying to strive for is equity. So no one person is the same as other people. So each of us have our own unique needs. And you guys highlighted how utilizing the Prepare assessment helps you pinpoint what some of those needs are and the resources that could help address those situations. So here are the last couple slides. I just have the an opportunity for those of you who are interested to join an affinity group that we are setting up through Mountain Pacific on increasing patient engagement through enhanced community partnerships. Again, you guys work hard at that every day, so I might be coming back to you asking you for some additional input and advice on how we help make this work across many of our rural and frontier communities. And then I have a resource slide, and I did see one more question come through, and it says, what criterias are you tracking for outcomes? So Jess or Lori, do you want to take that question?
I think that that's a really good question. I think that that's something that we're trying to kind of figure out right now. With the template that's in beta that I mentioned, they put patients on a, I think it's 1 through 20 ranking. So based off of how many questions that patient answers, they put them on a ranking and it'll show a trend line. And so what we're trying to do is figure out something similar to that for our patients using, what we call prepare. I don't know if that answers your question, but what we're basically trying to see is how do we close this loop, right? If a patient comes in and they have 4 needs, did our staff fully see that through and address it? And when they, came back and we screened again, did the patient self-disclose that those needs were met? I think is kind of where we're at. But I think that that's something that everybody's trying to kind of figure out right now, like what is useful and how do we best do that, I think. Do you have anything to add to that, Lori?
Just that our community health advocates, if the providers have not created a patient case in Athena, then the community health advocate creates a patient case, and we do not close those patient cases until all the needs have been addressed.
And I would like to add to that really quickly that nationally, we're looking at different ways to measure outcomes. A lot of what we're looking at with some of the work that we do with the state departments of health are the chronic disease prevention and management measures. Some measures you have within your EHRs, some that we're still trying to talk about. Some is along the lines of education and improving nutrition and lifestyle changes. So I think there's a lot yet to be reviewed and discussed, but if anybody has some, wants some specific information, please reach out to me. And again, I didn't list your contact information here, but if you send me a quick email, I can definitely get you directly in contact with Jessica and Lori, because they've been great and wonderful with their time. And we certainly appreciate all of their efforts and their successes and wish them many more as you continue to move forward, because this is big and daunting. And, sometimes people look at this and go, I don't have any idea where to start. But I think, my whole point is we'll find some place to start, and there's things that we can do together, I think, to make, all teach, all learn, and share our successes and best practices as we move forward.
Absolutely. That's really our interest in it. And I will say the power of food when training people is huge. We had the best outcome if we bought our staff lunch. That was a really big one. I should have put that on our lessons learned.
I hear it works for providers too.
It works so good. Yeah.
Always invite them with food.
Yep.
All right.
Yeah.
Excellent. Thank you so much for your time, everyone. I know we're at time, so we're going to go ahead and end this. But if you have any questions or concerns, please put those in the evaluation or contact me directly with the contact information on the screen or the slides when you receive them. Thank you very much for your time. Stay safe, be well, and we'll talk to you again soon.
Thanks.
Thanks.